Good morning, guys. I hope we're all sparkly. Just a quick video before I run the dogs. Gym session done. I've earned my reward. So, what are we going to talk about today? We're going to talk about potential TRT side effects. Now, there's a flippancy applied to jumping on testosterone replacement therapy. You're going to feel amazing. You're going to have muscles, sex all night long. Your mood's going to be amazing. Now, hopefully what you're going to have is reversal of your negative symptoms. So, less tired. Hopefully a healthy libido. Obviously, if you put the work in, you can gain some muscles. And hopefully a good mood. But mood is incredibly complicated. So, when you see adverts for testosterone replacement therapy and it's going to suddenly make you the man you want to be, caution. If something sounds too good to be true, no prizes for guessing, it's too good to be true. Now, with a healthy, well-balanced TRT protocol, and yeah, in my professional opinion, microdosing is the only way to do it. Okay, somebody says, I feel great with Monday, Wednesday, Friday. I'm pleased for you. But my patients microdose because it is the most effective way of achieving stable male androgen levels for long-term physical and psychological well-being. That is it. If there was a better way of doing it, we'd do it. But this is the best way. So with healthy testosterone levels, you should feel great. Well, okay, let's break it down. Because the negative symptoms, tiredness. If I get a bad night's sleep, how do I feel? Tired. My levels are perfect. If I had a stressful week, is my libido through the roof? No. I've had a stressful week. So, everything affects everything. But testosterone is the foundation and TRT is the catalyst for change. But ultimately, it's all up to you. So what are we going to do? Well, we're going to break down testosterone. So you can use testosterone as testosterone. It also gets broken down to DHT, dihydrotestosterone, and also estradiol, estrogen. All of those three hormones need to be in balance, and then you need to titrate your dose according to effect to get you where you need to be. We're all unique, not special. So there is a process and there is a journey. And you can sometimes feel a little bit worse before you feel better. But you have to trust the journey because you have to trust the journey. Pharmacokinetics and pharmacodynamics are pharmacokinetics and pharmacodynamics. It takes 5 half-lives to achieve stability. And again, we need to titrate the dose according to response. And your physiology has to catch up. It's been down in the dumps, hasn't it? So we can artificially raise your testosterone to normal, but your physiology has to go, all right, I need to go back up here. So your metabolic rate, the demand goes up, and you need to address everything in your life to be the person that you want to be. So let's break down each individual hormone. Now, we're fans of excess, aren't we? We love excess. I love excess. Oh, my past has been a bit checkered, but I'm now all about balance, stability, contrast to establish harmony, yada, yada, yada. So let's go for DHT first, dihydrotestosterone. Now, we like dihydrotestosterone because it's good for muscles, good for sex, and it makes you confident, makes you slightly aggressive in excess. Now, we don't want excess. We love excess. We don't want excess. And as we know, everything has to be in balance. Dihydrotestosterone to testosterone to estradiol. In excess, DHT is linked with cardiovascular problems, and we want a healthy cardiovascular system. It's not rocket science, is it? Some people worry about male pattern baldness, but that's genetic. Why am I bald? Well, I'm close to 50. My genes were fighting against me. I can't have a full head of hair. We have so many patients with full heads of hair, Viking beards. Male pattern baldness is genetic. Now, we don't raise DHT levels above normal because essentially you can't, because testosterone converts into DHT. So if DHT was elevated, testosterone would be elevated, and we'd be looking to lower your testosterone. So we can actually park DHT to the side. it brings us on nicely, obviously, to testosterone. So you go on the internet, it's all about muscles and sex. Now, I'm not going to lie, muscles and sex are quite important. But testosterone is fundamental to lots of cool things like bone strength, red blood cell production. Now, red blood cells is a wonderful example of why we don't want excess, and we love excess. Red blood cells carry oxygen to the tissue, so obviously it makes sense. Lots of red blood cells, lots of oxygen. But that red blood cell is a cell in the plasma, and it's being pumped by the heart. So more cells, thicker blood. Heart's not going to like that. The lining of the blood vessel is friable. Stodgy blood going through at a high rate. It's going to cause damage. You get increased platelet aggregation. So don't listen to the people saying you don't have to worry about hematocrit on testosterone replacement therapy. You obviously do. So all I'm going to say to you is stay hydrated, because we're going to be in charge of this, because you can't be objective in your subjective experience. Do not donate blood unless I advise you to, because you have something called hepcidin suppression on testosterone replacement therapy. That's essentially one of the enzymes involved in iron metabolism. It becomes slightly dysregulated. We can't tell how much as per the individual. So we look to quantitative markers, we look to blood pressure, etc. before we advise you accordingly. But just stay hydrated. Hematocrit is incredibly important. What else? Well, your lipid profile can become dysregulated by high testosterone levels, much like it can become dysregulated by low testosterone. Enough! So, testosterone. You can have too much. Now, we know that testosterone impacts the mood, and hopefully it's going to make you the man you need to be. But in excess, overconfident, not objective, and we want to be objective because we need to be considered in this world. We can't clout everybody round the head. One of the problems with society is, yes, there appear to be no consequences for your actions. You can get away with anything, which means we have to be controlled, because you can't get away with anything, and men should be men. So that brings us nicely onto estradiol, the female sex hormone. It's not the female sex hormone, much like testosterone is not the male sex hormone. So women have more testosterone than have estradiol. So it's absurd to say that, but obviously, as we said before, there are some very important sex differences. Obviously, sexual organs, but our genes express these hormones in a different way, and we obviously have different amounts and need different amounts. So estradiol, we do need estradiol. Lots of people let it run wild. Lots of people want to crash it. Everything has to be in balance, guys. The aromatase enzyme that converts testosterone to estradiol is located in numerous tissues. The only two tissues that you have to care about are body fat and liver health. So what am I going to say to you? Yes, be healthy. Again, not rocket science. So try and maintain a good, healthy body weight and put into your body what you need, not what you want. Your liver does a job. Don't stress it out, because we don't want overexpression of the aromatase enzyme to create more estradiol than testosterone, because whilst estradiol is neuroprotective and it gives you empathy and insight and understanding, in excess, it makes you emotional and anxious. And again, we want to be cool, calm and considered, not whiny little thingamajiggies. What else? Well, your cardiovascular system needs estradiol. In excess, it causes blood pressure and water retention. What else? Well, boobies. We love boobies, don't we? So excitatory. Estradiol is excitatory to breast tissue development, with testosterone and DHT being inhibitory. So you can see why the ratios of these hormones are super important. Now, gynecomastia is a little bit more complicated than that. Obviously, it's to do with progesterone, prolactin, and IGF-1 as well. And obviously genetics. So some people can run estradiol quite high and not have boobs. But that's not the point, is it? The point is balance. We don't want symptoms. We want prevention. Prevention is better than cure. So look to optimize your weight, look to optimize your liver function, which is quite difficult in our world because it's quite poisonous, isn't it? Plastics everywhere. What else? Prostate. Now, prostate cancer. Prostate cancer is on the rise. And it's not because we increase screening, it's because it's on the rise. Now, we're seeing in our society low testosterone to relative high estradiol. And there's more and more evidence suggests that that's causative, not whatever else they say it is. Because hormones are the foundation. Hormones are chemical messengers that help facilitate the function of their target organs. And we need healthy hormone levels for health. So, the journey is long. The journey is involved. We must look to address not only our testosterone, but also the other things that impact our health. Sleep, stress, nutrition, exercise, and mindset. Mindset is incredibly important. You must understand that you must see the glass as half full, not half empty. You must understand that you're in charge. You are in charge of how you feel. You can look to me to support, and I can give you as much support as I can give you, but I will always give you realistic expectations. I will tell you truths, sometimes harsh, but I'll hopefully deliver it in an empathetic way. Not sympathetic, empathetic. My job is to support you. And as you know, if you're my patient, it's tough love, baby. Is it time for a walk, Dex? It is, isn't it? So nothing else to say apart from, yeah, you know, go earn your reward.